All right, if you want to pass step one and do well on step two CK, you need to know this topic. A 73-year-old man presents to his primary care physician for a 3-month history of low grade fevers, night sweats, and an unintentional 8-pound weight loss. This is screaming cancer to me. Whenever you have night sweats, fever, weight loss, fatigue, all of that together, that is cancer on the USMLE. On examination, he has palpable lymphadenopathy. What does that mean? That just means big lymph nodes, whereas lymphadenitis means inflamed lymph nodes, which hurt in the cervical and axillary regions. And a firm mass is appreciated in the left upper quadrant. What is the one organ in the left upper quadrant? That's the spleen. White blood cells are 92,000. That's insanely high. Anything above 50,000, I'm thinking cancer on the USMLE. 90% lymphocytes. Hemoglobin is 9.2, which is low, and platelet count is normal. Reticulocyte count is elevated at 5.2. A peripheral smear shows small, mature appearing lymphocytes. Flow cytometry is pending based on the clinical presentation and laboratory findings. Which of the following would you expect to see on further diagnostic testing? MPO positive cells, that is going after AML. This is the Auer rods in acute myeloid leukemia. There's two ways this presents on the test: either the Auer rods, which is really buzzwordy, they'll show you a big picture of it, or they're going to mention myeloblasts. We don't have Auer rods here, and we have a bunch of lymphocytes. We have no myelocytes or myeloblasts. Philadelphia chromosome 1922 translocation, that's going after CML, chronic myeloid leukemia. You have to know the 922 translocation for that. And do you know what the treatment is for CML? That's going to be imatinib. Positive direct antiglobulin or Coombs test. This is the correct answer. What you need to know for the USMLE is that CLL, which is what this is, you can get autoimmune hemolytic anemia. And whenever you have autoimmune hemolytic anemia, you have a Coombs positive test, whereas something like hereditary spherocytosis is going to be Coombs negative. And because we have autoimmune hemolytic anemia, that's why our reticular count is so high at 5.2. It's trying to compensate for the low blood volume. As we can see here, the hemoglobin is 9.2. Let's go over the other answer choices. TRAP positive cells, that's going after hairy cell leukemia. This is going to be fibrotic bone marrow. And the buzzwordy thing for the USMLE is going to be a dry tap on aspiration, meaning we can't pull any bone marrow out on a iliac crest biopsy. CD10 and TDT positive lymphocytes, this is going after ALL. This is going to be a school age kid, super high lymphocyte count and lymphoblasts.